we're going to look at now is the EMS, the Electro-Muscular Stimulation. We're going to use a Globus unit. This is the Globus Elite. The Globus 115 will also do it. The Globus Sport will do it. But it's the Globus type that you need that's kind of like above like 200 quid. If you go for the one that's like 80 quid, it has different brand names in different countries, it doesn't have the settings on.
So that's British pounds.
British pounds for quid. Thank you very much. So, and what we do basically is where the, again, where the muscles have, normally the paraspinal muscles will be moving, contracting, back, contracting, relaxing, contracting, relaxing. That's a muscle pump. The heart sits around here, pumps the blood, they say around the body, but it really only pumps it away to the body. To return blood, kind of seeps back from the cells and the tissues into the veins. Not much pump left, and so it actually relies a lot on the muscle pump. Every time you move your muscles, the kind of blood vessels get squashed, and it's one-way valves, and that way it returns to the heart. There's twice as much lymph in the body as blood. Shows just how important lymph is to the system. The lymph doesn't have any heart at all. There's no heart to pump the lymph around. It relies, a lot on the muscle pump. Gravity is the other thing that it tends to use. There's talk of it having a little mini pump in the vessels and using all sorts of electrical bits and pieces. There's other stories, I'm sure, to be uncovered about it, but the muscle pump is a huge driver for the movement of venous flow of blood back to the heart and for the lymph movement. When you have an accident, the facet joints send a message out to the muscles either side of the spine to stop contracting and relaxing and to permanently contract for years and years and years and years. Could be until this message to switch off happens. And it's nothing to do with you not being relaxed and being a tense person or personality. This is completely autonomic. It's got nothing. The signal goes from the facet joints to your muscles. It's got nothing to do with your psychobiologies or whatever it is. You can be very happy, very sad, very angry, very tense. We're not looking at that mechanism at all, just from here to here. So what we do is having relaxed that muscle spasm with the ultrasound, we're now going to use the EMS to re-stimulate that muscle pump by getting the muscles to contract. And we give it a bit of a, they call it a square wave, but it kind of rises up, goes back down, and not quite exactly a square shape. And it gives like a 3-second squeeze or a 5-second squeeze. And this pumps out the gunk in the tissues that allows fresh lymph to come in. And we put some electrical pads down. We get a reasonable good pump going. Where there's one aspect where it kind of bump as a pump, and there's another one that just gives a few seconds squeeze and then relaxes. We do that for 3 to 5 minutes. Put the pads somewhere else, repeat, and do it on the neck perhaps, and that's it. Very simple adjunct that these two things just work. The EMS, the ultrasound, just work swimmingly well together. And they're very synergistic. There are therapists who use ultrasound, there are therapists who use EMS. Put them together, you really do get 2 + 2 = 5 in terms of results. So, alright, okay, so let's get on with the show. So having cleaned out the tissues, and so the tissue is now nice and pale, and the gel is cold to the touch, even if it's at room temperature, and cold generally has the same effect. It kind of dries out the blood from the area, which is where I generally prefer going. I don't like ice, is a bit rough, but cold gel rather than hot. I have had patients who tell me they've had a sore back for several months, and no matter how much they put their hot water bottle on it, pain doesn't go. I say, well, drop the hot water bottle, go for something, get a cold towel or ice pack if you can do it, and within a week, something's been gone for ages and ages is gone. And so getting stuff out is generally the way to go rather than heating things up. This is an EMS unit from Globus, the Globus Elite. They have several brands. This one I think is the lowest grade unit they have that does what we want, which is to do what they call the men's sculpting mode. And it has these square waves on, which will squeeze the muscles and then relax them. Squeeze the muscles, relax, and then it has a pulse mode. Then it does 5-second squeeze and relaxes. So it's sort of so you chat to the patient and you say, well, can you feel that? Mm-hmm. Okay. And we want them to feel it. We start off nice and low, and then this second mode is the pulse mode. Can you feel that?
Yeah.
Okay, so what they're doing now is they can feel pulsed. And then that goes up to a squeeze. And we do this for 3 minutes. Again, it's about squeezing out the gunk. It's not about, if you do too much, I mean, you can do 5 minutes. If you do very much more than 5 minutes, blood will come into the area, be overstimulated. Every time a muscle contracts, it pumps lymph back to the lymph glands, it pumps blood back to the heart. And if these muscles are in a permanent spasm, this whole area doesn't do it pumping, and that's a lot of the human body, and you get all sorts of problems. And along the spine, this is super busy in terms of electrical controlling of your entire body and repair of your body. So for instance, around here, there's mini brains that sort of called ganglion, part of the sympathetic nervous system just in front of the spine. They control the digestive system and repair of the digestive system. It monitors if there's food in the stomach or the like. It sends signals to switch off stomach acid production when the stomach's empty. If this is all gunked up, the nerve signals don't work properly. They misfire, and you get all sorts of stomach problems. If you have problems here, this area, girls get lots of period problems, and they have problems here, because lots of the sympathetic ganglion control the reproductive system and how things work. And then you can also get sort of problems with the knees and legs on the lumbar ganglion compromised, because they control the repair, they monitor and control the repair of the legs and the hips and the knees and bits and pieces. So problems down there physically can be fixed by fixing this area, doing this technique, so that works properly and this works properly to then fix things. Same problems with arms and hands and repetitive strain injury, wrist issues and stuff, that's controlled by the ganglion at the neck. So the spine is very busy. It doesn't just hold you up, it also does all sorts of stuff. So again, then you reproduce this by putting 2 things here and then 2 there all the way up the spine, and you can do that into the neck as well, and you get lots of benefits for the patient. If you gently hold it, these pads, it pushes them in a bit more, and you get the electricity goes deeper. It's in the milliamp range here. And the other thing is, if you don't know, last thing you want it to do is for the pads to peel off as the glue goes, and then you have the same electricity going through a shorter and shorter, smaller and smaller surface area, and then that might be a sore, stroke painful to the patient. And it also helps you to feel sometimes the muscle starting to contract, and to get a comfortable therapy, sometimes it doesn't happen the first go or two. You want them to feel it,
And the second thing is you start to feel the muscles contract. At the moment, at 11 milliamps, I can't. This goes up to 110 milliamps. Classically in the lumbar area, something about 30 is the sort of level you'd be working on, but different patient, there's a whole distribution curve of patients, and different patients, same patient will come in on a different day, and it'll be strong enough for them at 20, and another day it'll be strong enough for them at 40. There's quite a variance. So, chat. Can I go higher?
Mm-hmm.
I'm at 20 now, on the pulse mode. Let's go higher on this one, yeah?
Yeah.
15.
Mm-hmm.
I'm up to 18. No, I still can't feel anything, which is not... At 20 is about right. Can I go a bit higher, or yeah?
Yes.
To 22.
Mm-hmm.
And you can have a big difference between, if you're on 27, say, and you move up to 32, it can be a very big difference. So almost like, when you do kind of go higher by 1s and 2s rather than 10s or even 5s. A little higher?
Yes. Yeah, enough. Yeah.
Enough, you see. And when they say enough, I often drop down 1. So 23 seems to be enough. Let me take it to 20. So you can feel the pulse on that nicely?
Yes, yeah.
And we have 23. Oh, I can just feel the muscles contract on that myself now. And as they're contracting, they're pushing out gunk.